Rheumatology Medications Part 2, Methotrexate. Hi everyone, I'm Dr. Erin Carter. I'm a rheumatologist and internal medicine specialist, and welcome back to my series on common rheumatology medications. If you missed Part 1 on hydroxychloroquine, please go back and watch that video, but today we're talking about methotrexate. Many of you requested this one, so I thought I would do it next. Methotrexate is one of the more common medications that we use in rheumatology, and it's used to treat a variety of rheumatologic conditions. Now, methotrexate comes in a couple different forms. It comes in either tablets or a self-injectable form. Regardless of which form you take, it's still a once-a-week medication. So you pick a day of the week that's your methotrexate day, and then you will also be taking folic acid with it. Now, the folic acid can be prescribed in different ways. We give patients folic acid to help with some of the side effects of methotrexate. I personally prescribe folic acid every day, but some practitioners do it just once a week, so just follow whatever your doctor's advice is. Now, when it comes to side effects of methotrexate, to be honest, there is a huge spectrum. Some people feel totally fine when they're on methotrexate. Some people feel like complete garbage. Now, obviously our goal is not to make you feel like garbage. So if you are having bad side effects, I tell my patients all the time, just call me and let me know. We have other options of things we can try so we can stop this medication if it's causing you bad side effects. So what are the common side effects? By far the most common is GI side effects. So stomach upset, nausea, diarrhea, sometimes even vomiting. And now I will say that when you first start methotrexate, it is fairly common to get a bit of nausea when you first start it. That typically will resolve after a few weeks if it's mild. But again, some people have really severe nausea that does not get better. Now, methotrexate does lower the immune system a little bit. So if you get sick, cold, flu, cough, need to go on antibiotics, those types of things, we get you to hold your methotrexate for that short period of time until you're better. The other thing is that methotrexate has the potential to affect the liver and the potential to affect your blood counts. So when we first start the medication, we get you to do your blood work on a monthly basis to monitor liver enzymes and your CBC to make sure it's not causing any problems. And now every practitioner's monitoring is a little bit different. After the first 3 months, what I get my patients to do is to monitor their blood work every 3 months, but your practitioner may choose to monitor it monthly forever. As well, because of the potential to affect the liver, we don't recommend any heavy alcohol use when you're on methotrexate. And some practitioners will actually tell you to avoid alcohol altogether. Now, another important thing is that methotrexate is not safe for pregnancy or breastfeeding. It is teratogenic. So if you are planning a pregnancy, please make sure your doctor knows. And if someone is on methotrexate and planning a pregnancy, you have to stop the medication for at least 3 months before you start trying to conceive. Methotrexate will also make your skin more sensitive to the sun. And there's also a rare reaction in the lungs that can occur on methotrexate. But of course, everyone's response to medications is different. So sometimes patients can have rare side effects that we wouldn't predict, but if you're ever concerned about any side effects, please make sure you talk to your doctor about them. Now, I'm almost out of time, so if you have any questions, please leave them in the comments. And if you find this type of information helpful, please make sure you're following along.